Aussies vs Kiwis Diabetes Edition. It's a game we're honestly both losing, but community demands are slowly being met. I'm Dr. Naomi, and this is Bimbo Biology. I want to introduce you to these cuties, continuous glucose monitors. As their name implies, they keep track of the amount of sugar doing the rounds in your bloodstream. This isn't about tracking a sugar rush, it's actually about keeping us alive, because we would quite literally die if we didn't have sugar in our blood. It is our primary source of energy. This is because when you eat, food is broken down into sugar. The sugar goes into your bloodstream and your pancreas releases insulin in response. Insulin is a hormone which helps cells use sugar from your blood for energy. Your liver also stores this sugar for when you need it later. As the sugar levels in your blood go down, the pancreas makes less insulin. When insulin levels are low, the liver will just release the sugar that was stored to ensure that you have energy. This is a smooth running system that ensures we have constant access to glucose so we can live. In diabetes, this system is out of whack. Around 10% of people with diabetes have type 1. That's when the cells in the pancreas that produce insulin have been destroyed. The other 90% are type 2. And this comes about when the pancreas isn't producing enough insulin and the insulin isn't functioning correctly to control your blood sugar levels. Diabetes disproportionately affects minority communities, and it's exceptionally difficult to detangle from socioeconomic issues and other diseases that people might have at the same time. Continuous glucose monitors are a vital tool for people with diabetes. Not only can it significantly improve quality of life, but it can even save lives. So how come it was only last year that New Zealand funded continuous glucose monitors for people with type 1 diabetes? It has to do with Pharmac, the government's pharmaceutical management agency. For a long time, Pharmac just didn't invest into continuous glucose monitors, so heaps of people couldn't afford them. The lack of funding into continuous glucose monitors appears to have contributed to health disparities in children with type 1 diabetes, as well as increased inequalities for Maori and Pacifica people who already have increased rates of diabetes. This isn't unique to New Zealand. Indigenous Australians also have higher rates of diabetes, and it's honestly cooked. In fact, Aboriginal people in Central Australia have some of the worst rates of diabetes in the world. I'm talking 3 times higher than non-Indigenous people. And while in Australia, continuous glucose monitors have been available for people with type 1 diabetes, people with type 2 diabetes are left out. A recent Aussie clinical trial, co-designed with First Nations women who have type 2 diabetes, has shown promising results. Continuous glucose monitors, coupled with shared medical appointments, resulted in 1/3 of the participants achieving remission, which was maintained for a year. It's another piece of evidence behind demands that continuous glucose monitors should be made accessible for people with type 2 diabetes. In this Trans-Tasman diabetes match, Kiwis are catching up while Aussies take the lead, but the real winner here is simply good health. Community demands have had incredible sway on government decisions, so keep on screaming from the stands.